Hi, I'm Dr. Leo Powers, and I'm here today to talk about chiropractic. And chiropractic, there's many different techniques. My technique that I use is Sacro Occipital Technique, and it balances the head with the pelvis. And they divide the stress into category 1, 2, and 3. And when you get post-COVID syndrome, a lot of times you'll get category 2 stress, pain down the side of the neck, shoulder and arm and hand symptoms, pain down the side of the leg, front of the leg into the groin, medial knee and ankle and foot, lateral side neck pain, lateral side headaches, and that ties in with the organs, the liver, the pancreas, and the adrenal that regulate blood sugar. So a lot of times you get low blood sugar when you get post-COVID syndrome, when everything is normal, but it's really not normal because you feel tired and fatigued and brain fog. And so category 2 stress can take that chunk of that stress out. So I check for that when someone comes in, and I check for category 1 stress too. So category 1 is this one here, and that's respiratory fault, and so that ties in with sciatica down the back of the leg, and it also has digestive upsets. So you can get treated for category 1 that can help with digestive and respiratory type of stress. And this is basically an overview. It's not everything, but it does tell basically that they divide the stress into categories. Category 3 ties in with the disc. And if the disc is bulged, a lot of times you get pain down the back of the leg on one side, sciatica. But you can have pains in different areas, and a lot of times you're not moving very good, you're kind of stiff, you know, when you have category 3 stress. And there are organ connections to each of the categories, category 1, 2, and 3. And category 3 ties in with the kidney and then the uterus prostate with these muscles. And there's organ work, it's called chiropractic manipulative reflex technique. It's organ work on the gut that they go over. So a lot of times my treatment can take somewhere between 15 to 20 minutes, or sometimes even longer if you need it. And then this shows the head, and most people think the head's solid, it doesn't move at all, but actually it moves about 2 to 3 millimeters, you know, on each side. And so this shows when you're breathing in, it expands out, and when you breathe out, it collapses, contracts in, and this shows inhalation and exhalation. So there is a motion there. And how much is it? 2 millimeters. You know, how long is that? Is it this long? This long? An inch is 25 millimeters. So 2 millimeters is about 1/10 of an inch. So it does move significantly. And they have documented this through, you know, several different studies. So they proved it. So it is true. And then this is basically shows the pelvis, and this is the front, and this is the back, and the sacral. When you breathe in, it moves forward, and when you breathe out, it comes back. So there's a breath in, breath out component. And when you move it forward, then the cerebral spinal fluid, which is the fluid around the brain and the spinal cord, it moves down on breath in, and then on breath out, it comes back up. So it goes up and down. It's kind of like a ocean tide. It goes up and down. So that's part of how this works. And two things that pump the cerebral spinal fluid. One is the lungs, and the other, there's a wiggle in the brain, and it wiggles from the left or the right. And when it wiggles from the brain itself, wiggles. And there's 2 parts of the brain, the neurons that are the thinking cells, and then the glial cells, which are the fat cells. And the fat cells are the ones that wiggle. So anyway, so that's how that works. And then the glial cells, the fat cells, when they don't wiggle, then that ties in with the category 1, and it's all connected together basically. So what I do is I check the indicators when someone comes in to see whether in the category 1, 2, and 3, and usually you have a combination of all of the above, usually when you're sick. So anyway, and so we try to do our best to get you from disease to ease. So